Hello everyone. I hope that this is clear for now. Thank you for joining me in this course, in full cover course for AMC MCQ preparation. Please confirm that you can hear my voice clear and you can see the screen now is clear. You can use the side mini chat for answering this question. Okay, that's good, Dr. Rita, that's good, Dr. Ravi. So you can hear me clear and you can see the screen clear. If you don't know me, I'm Dr. Omar Shakoree. I'm a senior in accident and emergency surgery. I will be your tutor for this exam. So what we are doing in this course, we have two parts in this course. The first is the material. And the second part of this course will be the recalls. Let me draw something here. The most important is the material, not the recalls. I want you to focus here. We will do the materials materials like study medicine and surgery and so on. All the important topic will be discussed here. So we are not depending on the recalls. For 2 months, we will study everything important according to Australian protocols. After we do this, we can go to solve questions, but for now, do not solve any question without having this study material, without having all the knowledge, important knowledge you need to face these recalls. So, how we will deal with this course? We have, as you know, the Facebook Soma group, and we have the Zoom program, and we have email. So what is the benefit of every part for this course? So for the Facebook, you know the Facebook group that we have. In the Facebook group, you can put the questions of recalls you bring from other groups to see other students from previous groups and other members of the group, how they will solve. When I face some very wrong or mistakenly done answer, I will respond to that question. When I saw everyone is clear, everyone can handle this question, I will not give my answer. But when there is something wrong in the Facebook group, I will immediately interfere with that wrong. What about our Zoom meeting? Zoom meeting and Zoom mini group is just for you to discuss everything here about preparation from zero and how we will make the study and when you receive the call to join the meeting. Also, you will receive all the needed files in Zoom. Now, what is the benefit of email? In the email, I will send you the schedule totally, like what I did in the previous lecture. After this lecture, I will send you an invitation to the whole course dates. You can just say accept in the email, and this is automatically will go to your Google Calendar and saved as an event according to time of your local area. So you will not miss the time, you will not miss the lecture. That is the benefit of email when I sent you an invitation to the classes. Is it clear, please, everyone, until now? Any question until now? Okay. I will give you time for questions also. Now, what are the AMC material that we will discuss? We will discuss the medicine, we will discuss the surgery, obstetric and gynae, pediatric, psychiatry, and public health. As you see, medicine is the bulk. Medicine have 35 questions. Okay, sometime, Dr. Rita, sometime when there's something not important, I speak fast. When there's something very important, I make my speech very slow so you can understand the point of this speech. Now, regarding the questions, we have 120 questions for AMC MCQ. And those questions are divided like this. 35 questions are from medicine. 25 questions are from surgery. 15 questions from obstetric and gynae. 15 questions in pediatric. 15 questions in psychiatry. And 15 questions in public health. So what we will do here is to study from the psychiatry, and then pediatric, then gynae, then surgery, and then medicine. I will put the medicine near the recalls so you can understand the medicine very well and immediately do the recalls. That's the idea. For the recalls, my advice for every one of you now is not to do any recalls for this time. Not to do, please, any recalls for this time. Why? Because you need your theory, you need your information. Then go for recalls. Please, everyone, as Dr. Rita have a problem in the internet, please, everyone, confirm that you can hear me very clear without interruption and you can see the screen without a problem. So, Dr. Rita, try to have better connection. What about you, Dr. Omar? Okay, that's good. So, any question for the introduction? Any question regarding the course? Please ask any question before we will go to the lecture 1 in psychiatry. If you want to speak, just say I want to speak and I will immediately unmute you, and also you can unmute yourself to speak directly. Any question, please? If you don't have any question for now, you can just type no questions or no, so we will move to the second part. Hello again, everyone. This is Dr. Omar Shakoree. Please note that to get the most benefit of our class is to print the file and then watch the class. So how we will do? I want you to print out the file and then listen carefully to every note that I am saying and writing down these notes. Don't be afraid. I will repeat the notes many times so you can memorize it, you can write it, you can take the note over the file, and this after we do any class, I want you to re-study the notes that we are doing. Other things that are not, I will not say it, this means that those lines are not important. So when I say this is important topic, please write as important beside the topic. So we will start with the psychiatry. As you know, psychiatry questions are at least 15 questions. plus other non-scored question, and we will discuss these later on in the recalls, the scored questions, the non-scored questions. So I want you to focus on material now, to focus on study, to have the very good and organized information about every important topic. So now we will start with the most important topic. This is a very important topic, then anorexia nervosa. This is very important topic in your exam. Here, usually the patient is female and they are adolescent. The sex is female, the lady is adolescent. How the anorexia nervosa will present? How I know that this lady have anorexia nervosa? Simply by two words, skin and bone. Skin and bone, lady, in your exam equal anorexia nervosa. Skin and bone. Let's say this is just example, you don't need to write it, just write VV important beside the anorexia nervosa, and also write skin and bone, skin and bone. For example, you are in the street and you see a 16 years old female which looks like skinny and bony. Remember, this is the most important presentation for anorexia nervosa. So keep in your mind, this lady may having anorexia nervosa. What else is important as an presentation? The language here is important as a presentation. And as I told you, the body weight is very low BMI. As I told you, it's skin and bone. This lady having skin and bone presentation. FSH and LH, the hormones, are decreased. Estrogen, progesterone decreased. And this is the second important presentation. The estrogen and the progesterone in this lady. Why this is important? Decreased breast atrophy, blah, blah, blah. This is a lot of speaking. We need to make it simple. I will give you a scenario. As I told you, you are walking in the street and you saw a lady skin and bone, or you are sitting in the clinic and a lady with very low BMI, skin and bone presented to you in the clinic. Keep in mind the anorexia nervosa. What about other presentation? A lady presented to you with amenorrhea. Lady presented to you with amenorrhea. Amenorrhea means there is no cycle, there is no menstrual cycle for this lady. And we will speak about amenorrhea and profuse in gynecology. But here I want you to keep it in mind. Keep in mind, in amenorrhea, one of the differential diagnoses is anorexia nervosa for primary amenorrhea, not the secondary, for primary amenorrhea. So just make it for primary amenorrhea. Nowadays, they make a scenario, new scenario, for telling you what is the most common complication for a lady with anorexia nervosa. Lady with anorexia nervosa. What is the most common complication for anorexia nervosa? For this lady, it is amenorrhea. The most common complication for a lady with anorexia nervosa is amenorrhea. So this is the nowadays. If they want to make it more difficult, they will just say a lady with low BMI, skin and bone lady. What is the most common complication for this lady? So it's the same, but they didn't give you the name of disease. They give you the key of disease. The key of disease in your exam is low BMI, skin and bone. Skin and bone in your exam equal anorexia nervosa. Anorexia nervosa complication is amenorrhea. This is the complication. Clear, please, until now, everyone? Okay, that's good. Now, what is the second complication that's also common, but it's not the most common? As I told you, the most common is amenorrhea. Just before jumping to the second, why amenorrhea? Why this lady developed amenorrhea? You need to know it because there's estrogen and progesterone decreased. Because the estrogen and progesterone decreased. And why estrogen and progesterone decreased? Because of FSH and LH decreased. Now, what is the second common complication? As this is a skin and bone lady, very thin lady, very low BMI lady, the second most common is that this lady may have stress fracture. Stress fracture could occur in a lady with anorexia nervosa. This is also important. Pulse of this lady, I want you to know that it's bradycardia. Blood pressure, usually this lady having hypotension. But I want you to know another most common here. Most common, please note that the most common cause of death in this lady. Let's see the lady before going to this. As you see, this is the lady with thin and bone. You see it in the picture. When she looks to the mirror, she thinks she is fat, but unfortunately, this is wrong perception. This is just for knowledge, no need to write it. This lady have wrong perception that she is obese while she is thin and bone and skin. So this lady may die. What is the most common cause of death in this lady? The most common cause of death in this lady is arrhythmia, cardiac arrhythmia. Due to what? Due to having hypokalemia. This lady having hypokalemia, and this is very important question in 2018 and still in 2019 and previously in 2013 and 14. So hypokalemia is very important in the lady with anorexia nervosa. Why hypokalemia occur? Because there is electrolyte imbalance. As you see this body, of course there is electrolyte imbalance. One of them, which is important, is the hypokalemia, and this lead to cardiac arrhythmia, and this is the most common cause of death in this lady. It's account for 15%. It's not important. This percentage is not important, but just I want you to know the cause of death in anorexia nervosa. So just on this line, there's one question which is very tricky in anorexia nervosa. They ask, what is a lady, typical scenario, skin and bone, or a lady with anorexia nervosa? What is the most important investigation you will send this lady? Any idea? What is the most important investigation that you will send this lady for? I will give you 1 minute to answer this question. Any idea what's the important investigation? I need one, Dr. Rita. They will put electrolytes in a separate option and they will put ECG in another option. So what do you think? Which one you will choose? She is not yet died or dead. Electrolyte is the option. Electrolyte is the main option, the main investigation, because we want to detect the hypokalemia. If this lady having hypokalemia, she will be in danger of developing cardiac arrhythmia. Maybe now she is just hypokalemic, but there's no arrhythmia, so there is no benefit of doing ECG at time of presentation unless she is in emergency situation. So what is the most important investigation to be done? It is serum electrolyte for this lady. And this is number one. And if sometimes they will manipulate like this, they will put not serum electrolyte, they will put serum sodium, serum potassium, serum calcium, and serum chloride. What else? What do you choose? What you will choose? If they will put serum sodium, serum chloride, serum potassium, what you will choose? Of course, we will go for serum potassium because we know that the most important electrolyte in the anorexia nervosa is the hypokalemia, the potassium level, because hypokalemia leads to cardiac arrhythmia. Cardiac arrhythmia is the most common cause of death in this lady. There's another question telling you what is not routine in anorexia nervosa. What's the investigation that is not routine to be done in anorexia nervosa? It is FSH and LH, the gonadotrophin, the FSH and LH. And this was very old question. Now, what about if this lady, and this is also very old question, but still it's important because I want you to know it. If this lady, look to this lady, the very thin lady, if she become pregnant, of course she will give a very thin baby. She will give a low birth weight baby. Now, how we will treat this lady? Of course, this lady need the first step and the most important step and the best step. Here I want you to know that the best step, the most important step, the next step in the management when a lady presented like this is hospitalization, involuntary admission, involuntary admission. Even if she does not accept this, she needs involuntary admission. And the second important thing, as I told you, to protect her from the hypokalemia, so we need electrolyte correction. Those are the main two lines of treatment. Please note, and this is a new question in 2019, a lady with anorexia nervosa plus infertility, what is the next as a treatment here? Yes, you will hospitalize this, yes, you will this lady and correct electrolyte, but when she came for infertility and she is anorexia nervosa, very low BMI, increase the weight of this lady is the first step. Increase weight of this lady for the first step. Please, I want you to know that BMI, last BMI, the normal BMI, put it here. Normal BMI is between 18.5 to 25, 18.5 to 25. Low BMI is the BMI below 18.5. Now let's move to bulimia nervosa. Bulimia nervosa. I call this condition like the cousin or nephew for the another condition. So anorexia nervosa and bulimia nervosa looks like a cousins. Here we have a lady. I want you to understand it. As let's see the picture. As you see in this lady, this lady have wrong perception of that she is obese. This is the anorexia nervosa lady, while the bulimia nervosa lady is not like her. Here we have a lady, as you see this lady. We have a lady here. She like to eat. She want to eat. But after she ate, she feel guilty. So try to induce vomiting. Again, in bulimia nervosa, or let's say in anorexia nervosa, lady look to the mirror, say, oh, I am obese, I should not eat anything. So that lady will be skin and bone. That is anorexia nervosa. Bulimia nervosa, it's like the cousin of that disease. But here we have a lady who likes to eat and not want to eat a lot, but after eating, she feels guilty. That's why she go to the bathroom, she induce the vomiting. So, what are the difference between them? Here, both are eating disorder, psychiatric eating disorder. Here we have the normal body weight. Here we have normal body weight. How I can know it in the scenario? In the scenario, they will tell you the exact scenario. As I told you, the patient feel guilty and sometimes induce vomiting. And also you can find dental enamel erosion. Dental enamel erosion. This is very important. And erosion of the hand. As you see in those pictures, erosion on the hand, that's because of induced vomiting and dental erosion also. So if you have scenario of eating disorder and BMI was normal, never ever to think about anorexia nervosa. This is another disease. This is mostly bulimia nervosa because body weight within normal limits. Third disease in eating disorder is the body dysmorphic disorder. Body dysmorphic disorder is not related to eat 100%, but here we have a lady, also this is a lady. Here we have a lady, when she looks to the mirror, she saw that I have long nose, I have very bad face, I have to correct this. This lady have body dysmorphic disorder. And this lady really is the one that every doctors or center dealing with dermatology want this lady to come because they are very profitable. So here, how you know this disease? Simply by this lady have multiple visits to dermatologist and plastic surgeon, attempt to hide the deformity. I remember one lady, and really she was very beautiful, but she came for reconstructive surgery. Again, please, can you hear me clear now? Confirm that you can hear me clear now. For body dysmorphic disorder, here we have a lady with multiple visits to dermatologist and the plastic surgeon. This is the key word to know that this lady having body dysmorphic disorder. I remember one case, she presented to us for reconstructive abdominal surgery about 1 year ago, and she's really, she was very beautiful, but she's still having the problem for doing reconstructive surgery in the nose, in the mouth, in anywhere in the body. She has body dysmorphic disorder. I remember my teacher did for her 2 operations, other seniors for another branch do for her other operations. So that lady having body dysmorphic disorder, and she needs psychotherapy, better than doing multiple surgeries. Now this is very important. The risk factors here are very important. For anorexia nervosa, what is the risk factor? The family history of athleticism. If you have a lady with family history of athlete family, this lady are in danger of developing anorexia nervosa. For bulimia nervosa, a lady with a family having obesity, lady in a family who are having obesity, of course she will take a food, then she will feel guilty, so she will induce the vomiting. This lady having bulimia nervosa, especially if she is from obese family. Binge eating, not important. Causes of body disorder, bulimia, blah blah blah, not important. Hypochondriasis is not body dysmorphic disease, and we will discuss that also. Okay, let me repeat this so you will never forget anything. Now, eating disorder, anorexia nervosa, simply it's a female adolescent, and this female having low BMI and having longer hair. BMI of this lady is below 18.5, and she is skin and bone. She is amenorrhea because of the estrogen and the progesterone is low, and FSH, this is because FSH and LH is low. And this amenorrhea is the most common complication in this lady. Also, another complication that could occur is stress fracture due to decreased bone mass of that lady. Also, the most important thing in this lady is the hypokalemia, the electrolyte imbalance, because hypokalemia lead to the most common cause of death, which is in this lady cardiac arrhythmia. What if this lady become pregnant? Of course, she is very thin. She will give a very low birth weight baby. What are the investigations that are not routinely used in anorexia nervosa? It is the FSH and LH. What if you have anorexia nervosa plus infertility? The first thing is to increase the weight of this lady. This will correct the FSH and LH, then correct the progesterone and estrogen secretion. That's the idea of increasing weight. What about bulimia? Bulimia is the cousin of anorexia. Here we have a lady with normal body weight, and there is sometimes self-induced vomiting after eating and dental enamel erosion or erosion in the hands. Body dysmorphic disorder, this is the beloved patient of the dermatologist and the plastic surgeon. They will do multiple operations over this lady and they will get money from her. So this lady needs to be treated by psychiatric for psychotherapy treatment. The risk factor for anorexia nervosa is the presence of athleticism in the family. The risk factor for bulimia is the presence of obesity in the family. Clear, please, until now? Any question? Any question, please? If we correct the weight in anorexia nervosa, Dr. Ravi, this will solve all the problems of anorexia nervosa. This will solve the amenorrhea, and this will solve the electrolyte imbalance in that lady. That's why we admit this lady involuntarily to the hospital. Okay, let's move to the second part of psychiatry. We will speak about personality disorder. Personality disorder are very important in your exam. We will speak about the paranoid, schizoid, schizotypal, avoidant. So what is paranoid personality? Here, paranoid personality is the suspicious personality. Suspicious personality. This is the only thing I want you to know about paranoid, nothing else. The suspicious personality. The schizoid, schizotypal, and avoidant, all three are important because all three are sharing something together. All these three types are sharing something. The avoidant personality, schizotypal, and schizoid, all of them are isolated person. Schizoid equal isolated person. Schizotypal equal isolated person. Avoidant equal isolated person. But how we know this is schizoid, schizotypal, and avoidant? In schizoid, we have isolated person and does not care about everything. Isolated person does not care about anything. Yes, doctor. Schizoid is isolated person plus does not care about anything. So, does not care about people, does not care about sex, does not care about criticism. I will give you one logic example. real life. You may have friends like this. When you came to this person who is schizoid personality, and you ask this patient, why you are not married until now? Why you don't want to marry? He will say, I don't care about people. I don't care about marriage at all. So this is schizoid personality. Okay, until now, everyone? This is isolated personality, does not care about anything. What about schizotypal? Schizotypal is isolated personality plus having magical thinking, ideas of reference, blah, 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 and persecution. What does mean? What this does mean? Here we have isolated person, and this person is isolated because he thinks that the people speak about him or make a problem or thinking about him. So he has a magical thinking that everyone speak about him. That's the idea of reference. Or everyone want to do problem with him. That's the persecution. So here we have isolated person who have magical thinking of idea of reference, everyone speak on him, and persecution. The same example, if you ask this schizotypal person, why you are not married until now, he will say, I cannot answer you. Why he will say like this? Because he will think that you are planning to do something, interfere with his life. So he is making a big thinking, a magical thinking of something, introduce you to have a big issue with his life. So this is the magical, this is schizotypal person, and this person is isolated because of is having this thinking. Now, what about avoidant? Avoidant is also isolated person, but here you have isolated person because he is low confident. Isolated person because of low confidence. This is, for example, in this patient, if you ask him why you are not married, because he is, maybe he's 40, 50 years old, maybe older. If you ask him why you are not married until now, he is not married because he is afraid of refusal. Why you are not having a girlfriend until now? Because he is avoidant personality. He is afraid of the lady will say no for him, and the vice versa for a lady and for a man. So I would repeat all the three types. Those are very important personality. Schizoid is isolated because he doesn't care about anything. Schizotypal is avoidant because he is having thinking of everyone speak about him. Avoidant is isolated person because he is low confident in himself. Please, everyone, is it clear? All these types of personality? Yes, doctor, please, I start speaking because I want you to confirm that is it clear or not, the whole three personalities. Okay, I will repeat it again. Simply, schizoid is isolated because doesn't care about anything. Schizotypal is isolated personality because of magical thinking of ideas of reference, and avoidant personality is the one isolated because of low confidence. Clear, please, everyone? Okay, that's good. Now to another very important personality. V important personality. The borderline personality. Everyone will get a question on borderline personality. So it's very important topic. I can say it is fixed in the exam. Here, simply, I want you to understand, we have female, this lady having mood swing, her mood is not fixed, like sometimes um, she is euphoria, sometimes she is depressed. She had marked impulsivity. What we mean by marked impulsivity? Like a lady, she is a young lady and she have the power to do everything, like crazy parties, naked parties. Those are mostly who planning for these are borderline personality. And she has also unstable relationship, and this is very important. This is the key for diagnosis: the marked impulsivity and the unstable relationship. And this lady also, because of she is very impulsive, she may sometimes do suicide. So she has suicide ideation. Now, how we know this? Let me draw again. I'm gonna bring this. We have this mood. This is stable mood. Sometimes our mood becomes euphoric. Sometimes we are depressed. But in this borderline personality, her mood will be like this, like sometimes very high, sometimes very low, and sometimes there is impulsivity go up, and sometimes there is impulsivity let her to do suicide. So this is the mood of the lady with borderlines. And there is something called splitting. This is very important in this lady. What we mean by splitting? This means that this lady has just the white and black view. What I mean by this? Let me say, if you ask me or if you ask yourself about any person in the world, you may say he is a good person, you may say he is bad person, you may say he is a little bit good and sometimes bad, he is a normal person. So let's say this is the white when you say this is a good person, and this is the black when you say this is a bad person, and this is the gray when you say this is a normal person. This lady, the borderline lady, she have no gray view for everything. So everything in her life, either it is very good and professional or very bad and the worst in the world. No in between. Here there is nothing in her dictionary. So if she has a boyfriend, sometimes he is very good, and then he is the very bad one in the life. There is no medium for that. And everything in her life related to shopping, related to every single daily event, she has this splitting. So this splitting lead to the unstable relationship. That's why no one can tolerate her splitting condition. No friend, not the family, everyone cannot tolerate this splitting. Even now, let's go to the scenario in the exam. There is a lady, psychiatric patient, this is an example from 2017. There is a lady, psychiatric lady, goes to doctor and she say, I want to be treated by Dr. X. He is the best in the world. I don't want to go for Dr. Y. He is the worst in the world. What is the diagnosis in this lady? What is the diagnosis based on this? She say, I want to go for Dr. X. He is the best one in the world. I want to not go for Dr. Y because he's the worst in the world. Who is this lady? This is the borderline personality lady. Now you will say, what? Sometimes we say this, Dr. X and Dr. Y. Yes, sometimes we will say this in the real life. We will say, I know this is a good person and this is a bad person, but we will not do anything to make a problem for this bad person. And the borderline personality, if you are the doctor, it's the one that all the psychologists afraid from dealing with her, because if she put you in the good doctor, she will make everything for you. She even will speak about you in front of every person, every society. And if she is um, doing news or something like that in the television, in YouTube, she will make you the number one in the whole world. But if she puts you in the black area, believe me, this lady can make a problem going to the courts to make a problem for you. So that's why all the psychiatrists, if you ask them about borderline personality, they will say those are the most, not difficult, but the most annoying cases because of the splitting. If this lady, now she is good with you, but later on you for any reason she put you in the black area, she will do everything from her effort, even to judge you in front of court and to in front of the television and social media and everything, just to say you are bad, you are bad, you are bad. That is the splitting. It's very important. Please clear until now. Please confirm, everyone. Just write, confirm for me, is it clear or not until now? I know it's very bad drawing. That's good. Now let me remove all these things. Nowadays, there is another question about splitting. Nowadays, there is another question about splitting, telling you that this lady don't want to be treated by this staff and want to be treated by staff of the another department of hospital. Again, nowadays I saw a question 2019 telling you this lady does not want to be treated by this nurse of this department. She asked to be treated by the nurses from the other department in the hospital. What is this? This is splitting. This is borderline personality disorder. What is the treatment? The treatment is dialectal therapy. The treatment is dialectal therapy. If you have a lady, it's the same scenario, but in 2019, they changed it from doctors to the nurses. Lady who does not want to be treated by the staff, the nurses of this department. She say, I want the nurses from other department, like she is now in gynecology, and she asked for the nurses from department of delivery or department of cesarean section to treat her because she said they are the best and here I don't trust, for example. So this having splitting, she has the white and black view. What is the treatment for borderline lady? It is dialectal therapy. Please note that unstable relationship equal multiple divorced or 2 to 3 relationship fail or recently divorced. Unstable relationship equal multiple divorces or boyfriends left her or recently divorced. Now, narcissistic personality. Narcissistic personality simply here the patient who come to you telling you, I am like this, narcissistic personality patient, I am a VIP patient, you have to deal with me like this. So this is the narcissistic personality. The patient or the person who feel himself as a VIP, special one. Self, like you don't need to memorize all these things. Just understand who is the narcissistic. Narcissistic is the person or the patient who feel himself as a VIP one. Antisocial personality. Here we have the criminal personality, person with the crimes over 18 years old, because we have below 18 for pediatric, and we will speak about that. Antisocial is crimes personality more than 18 years old. In children below 18, we call it conduct disorder, and we will speak about conduct later on. Conduct disorder is criminal child below 18 years old. Obsessive compulsive, here it is obsessive compulsive personality disorder. not the obsessive compulsive disease. Here we will speak about obsessive compulsive personality. What is this? This is a lady also. She like the perfectionism. For example, lady who like perfectionism, she wants everything in the place. She wants everything in its place. Like in this picture, she wants the pens like this. She wants everything orders and in a place and no one to change the orders. So this is obsessive compulsive personality disorder. Dependent personality, also important. Dependent personality, also important. Who is the dependent personality? Here, just I want you to know, the dependent personality is the person who depend on other. Person who depend on other. Usually, she is a female. As you see, this female depend on that man. The typical example is a female with domestic violence and she does not leave her partner. A lady with domestic violence not leaving the partner. What is this? This is dependent personality. This lady, dependent personality. She depends totally on a husband or other family member. I have met one dependent personality about 2 years ago. A lady presented to me with multiple ecchymosis all over the body. After taking full history and speak to her alone, she said that she was beaten from the husband. I told her, why you still with him? Or why you still not inform the police? She said, I don't want to leave him. Okay, this is the dependent personality. Okay, I will repeat this again. Is my voice clear, please? Can you hear my voice clear now? Okay, now you can hear me clear. Now the dependent personality is the lady who, second. The dependent personality is the lady who depends on the husband or the family member. As I told you, I receive a lady with multiple ecchymosis all over the body, and this lady having dependent personality. Now to the histrionic type personality. Histrionic lady. This is also very, 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 very important in your exam. Histrionic lady. Here you have a female, let me say, the queen, to make it easy for you, the queen of seduction behavior. the queen of seduction behavioral. Please, can you hear me clear? Can you hear me clear? Please confirm that. Omar, you can change the message to be for all, not just privately to be seen by me. There's an option to make it for everyone, so everyone can see your words also. Now, histrionic personality, this is the lady of seduction behavioral. This is the lady for, I call it the queen of seduction behavioral. This lady is also called the colorful personality disorder. This lady is like this. The lady, just write it, the lady who is stylish and love excitement and being the center of attention. She wants to be number one in the society. This lady wants to be number one in the society. Number one by excitement, by colorful, by seduction. So this lady, you as a doctor, especially the male doctors, you are a target for this lady. There's a scenario coming 2015-16 telling you a colorful lady presented to you and seduce you. What is this personality? This is histrionic personality disorder. Now let me repeat all the personality disorders as a one unit. For personality disorder, we have paranoid. Paranoid is the suspicious one. Schizoid, schizotypal, avoidant, all are isolated. The schizoid is the one isolated person and does not care about anyone. Schizotypal personality is the isolated person with magical thinking that everyone speak about him. Avoidant personality is the one who is isolated because of low confidence. Borderline personality, this is the lady with unstable relationship, multiple friends left her, multiple marriage and divorce. She has marked impulsivity, mood swing, she has splitting, and this is the most important, splitting. She does not have the gray area, she just have the white and the black area. That's how I want you to imagine it. She has just the white and the black area, no gray area in everything. That's why she has an unstable relationship. Also, she has suicidal ideation. How we treat this lady? We have to treat her by dialectal therapy. Dialectal therapy, what is that dialectal therapy? Just for knowledge outside of exam. Dialectal therapy means you have to make a dialogue speaking with this lady. Speak and speak and speak and speak. Narcissistic is the VIP patient, VIP personality. Antisocial is the criminal patient over 18. Conduct disorder is the criminal child below 18. Obsessive compulsive, this is a lady with perfection. Dependent, a lady who depends on other person. And even if he beat her, she will stay, live with him, and does not left him. Histrionic, the lady of seduction behavioral, the lady of seduction behavioral. The colorful lady, especially you as a doctor, is a target for this lady. Why? It is not because you, it's because herself. She wants to be in the center of point of attention. So if she have a doctor as a boyfriend, this lady will go to her friends and say, I have the Dr. X or Dr. Y as a my friend. I can handle everything with him. So this is the idea of histrionic personality. Clear, please, everyone? Please confirm that it's clear, everyone. Okay, that's good, Dr. Omar. Now you send the message and everyone can see it. Okay, I will stop here for a break of 30 minutes. Break for 30 minutes. I will back after 30 minutes to make a new call and to have you in the meeting. So take a rest, take something, drink something, and we will back in 30 minutes. Hello everyone, back to you again. We will speak now about the childhood psychiatric disorder. The first VVVVVV important topic is ADHD, which is attention deficit hyperactivity disorder. Please confirm you can see the screen and you can hear my voice clearly. Okay, that's good. Now, please, I want you to understand what is ADHD. From the name, here we have two things. From the name of this disease, we have a child with attention deficit. There is a problem in the attention, and there is hyperactivity. So this is attention problem and hyperactivity problem. Both should be present in a child to say this child having attention deficit hyperactivity disorder. Usually the age of school age is 5 to 7 years old. A child with move a lot like this, hyperactive movement and attention problem. A mother will present to you telling you that my child is hyperactive child. Please, doctor, help me. Mother present to you with the hyperactive child. What is your action? If you have a hyperactive child, be sure that is this hyperactivity associated with attention problem? How to know that? By checking the academic performance. Not every, please note this, not every hyperactive child mean ADHD. Not every hyperactive child mean ADHD. To say there is ADHD, we have to check for the attention deficit. How we check it? By checking the academic performance. So, what we will do for this lady? A lady presented with her child as her child is hyperactive. So what you will do for this lady? You will call the school of her child, ask them about school performance. You will call the teacher, check for the academic performance of the child. If this child who is hyperactive having poor academic performance, this means that this is ADHD. This child have ADHD. Again, lady presented to you with hyperactive child. What is next? Call the teacher, asking for the marks of that child. If he has poor academic performance, this means that this child have attention problem, and also he is hyperactive, so he is having attention deficit hyperactivity disorder, ADHD. What is the differential diagnosis? Differential diagnosis is deafness. Differential diagnosis is deafness. Of course, if you have a deaf child, of course this deaf child cannot obey command and he will be hyperactive. Now, if you have the same scenario, hyperactive child, if you have the same scenario, hyperactive child, and presented with a speech delay, what is next? Do hearing test, check for deafness. If you have a speech delay with hyperactivity, what to do? Check the hearing of that patient, that child. So regarding the management, the lady presented to you with her child. What is the first step? Call the teacher, ask for school record. The drug that we are using for ADHD called methylphenidate. Methylphenidate. Methylphenidate is one of the drug that used, one of the amphetamine drugs. Just I want you to know this. It was very old in 2008 or something like that. Methylphenidate is one of the amphetamines. Methylphenidate is one of the amphetamines. So methylphenidate could lead to drug addiction. Methylphenidate, the drug for ADHD, may lead to drug addiction because it's one of the amphetamines. It's psychostimulant drug. It's psychostimulant drug. There's a question in 2017 telling you child diagnosed as ADHD and receive methylphenidate, how you will assess the response for the treatment. Of course, how you will assess the response of treatment for any drug, you will check the symptoms. If the symptoms resolve, this means that this drug is acting on that patient. So it's, I don't know, it was very easy question, but some people, some doctors shocked by this question. I will repeat, attention deficit, ADHD. Its common age is 5 to 7 years. The lady presented to you with her hyperactive child, complaining of hyperactive child. What you will do? You will call the teacher and ask for child school record. Why? Why? Because you want to know if he has attention deficit. So if the child have bad record, bad or poor school record, this means that this child having ADHD. One of the differential diagnoses, the important differential diagnosis for ADHD is the deafness. Of course, if you have a deaf child, this child cannot hear well. So there is the same scenario of ADHD. I mean, by the same scenario, I mean the hyperactive child with speech delay. What to do next? Not to call the teacher, no, do the hearing test. Check the hearing of that child. Maybe he has deafness, partial deafness, so he cannot hear well. That's why he will not respond to you. The treatment is methylphenidate, and this is a psychostimulant drug, one of the amphetamines, and may lead to drug addiction. How you assess the response to the treatment? By reduction of symptoms. Second topic is the autism. Autism is very important topic, but it's easy in the exam. Just few notes. Autism can be diagnosed by the mother. Here you have usually before age of 3 years can be diagnosed. I want you to know this child, as you know, this child prefer one play, decreased communication, decreased sociability, speech and language, behavioral delay, fascination with a certain toy or like one toy, repeated behavioral also. I want you to know this. This is very important. This child with autism, 75% of them are mentally retarded. Not like what's shown on TV, on a series, to make the autism person as the one who is very clever. No, 70% of people with autism are mentally retarded. Asperger is very important. Please confirm that you can hear me clear now. Okay. Asperger syndrome is a very important syndrome. It is the same like a cousin of autism. Let's say autism and Asperger are cousins. So Asperger is autism, but there is no language or cognitive delay. This is the one who is having a good marks in school. So it's autism-like disorder, but no language problem and no cognitive delay. That's mean the clever one. So if you watch the series, which is The Good Doctor, and telling you that there is autism, junior doctors, junior surgical resident, and he has autism and he is very clever. If we go medically about this condition, we can say this is Asperger, this is not autism. Yes, he is having repetitive activities and behavioral, and he is interested in a scalpel tool that he holds in the pocket, in his pocket, but he has no language problem, and he is clever in the school, so he doesn't have the mental retardation. So that series and that character is Asperger, not autism. Okay, everyone? Clear until now? Red disorder, not important. Torrid syndrome or tics, also important. Usually it's male. Usually the age is about 6 to 7 years. Genetic, it is autosomal dominant. Here, important. What is the key for tic syndrome or Torrid syndrome, which is known as a tics? I want you to understand it. Here we have a child repeated something many times. Again, we have a child like this, exactly. Child repeated something multiple times. The something is either it's motor or vocal. So we have child, the keyword for Torrid syndrome. Child repeated something multiple times. This something is either it's motor, like blinking eyes, grimacing, trunk movement, either vocal, like grunting, coprolalia. Coprolalia mean when you say going, he will repeat the last ing, like going, ing. This is coprolalia. Those tics occurring many times per day. What is the treatment for tics? The treatment is to give drugs, give antipsychotic drugs like haloperidol and risperidone, and we will speak later on about the antipsychotic in details because they are important. So, Torrid syndrome, I want you just to understand how to diagnose this child. The diagnosis is important here. This is a child with something, repeated something multiple times. Child repeated something multiple times. What is those something? Usually it's motor movement or vocal behavioral. How we treat this child? By giving him antipsychotic medication. Now to the obsessional deviant disorder. Obsessional deviant disorder. No, usually they are not mentally retarded. They are normal child. Now to the obsessional deviant disorder. Who is the obsessional deviant disorder? Also, I want you to understand the scenario. I can say here we have just like this, the angry child. The angry child. Who are those child? To make it more clear, because we know, if we know this, we will face that there are some children from friends or relatives that they have obsessional deviant disorder. Those are, for example, a child who is not afraid of even the older one, become very angry with the adults. If you say don't, if you have a child playing in a round and you say stop playing, he will become anger and he will shout on you and he may cry in very loud voice. This is obsessional deviant disorder. Sometimes if the child play with a toy, for example, simple toy, and you take it from him, some children will just cry, some children will accept that, but there are just a few children who may fight you back for this toy. Those who fight the adult and they are not afraid, fight in a way they are not afraid from you. Those are the obsessional deviant disorder. I will repeat them, Dr. Omar, don't worry. Those are the obsessional deviant disorder. Another example, a child, 4 years, 5 years old child, when he was playing with his sister, for example, who is older than him, let's say 8 years or 7 years old sister, he pees on his clothing, and his sister laugh on him. Just imagine, child playing with sister, he pee on himself, the sister laugh on him, and he become anger and start to beat his sister. This is typical scenario in 2018 of obsessional deviant child, obsessional deviant disorder child. Now the conduct disorder, this is the criminal child. This is the criminal child who is below 18 years old. Just this, I don't want anything. This is the criminal child below 18 years old. What are the causes to become conduct, this child to be criminal? Usually there is child abuse. Usually there is child abuse. Again, conduct disorder is the criminal child. Conduct disorder is the criminal child below 18 years old. What are the causes of being criminal in this child? Why he is a criminal? Usually there is a history of child abuse. There is a history of child abuse, drug or alcohol abuse in the family, or family conflict. What is the long-term prognosis of this child? This child usually become antisocial person, antisocial personality. Now the conduct disorder, I will repeat the conduct disorder. Conduct disorder is the criminal child below 18. What are the causes of this child to become a criminal? Usually child abuse, drug or alcohol abuse also lead to, and family problem, family conflict also lead to criminal child. What is the long term in the future? This conduct child, this criminal child will become criminal adult, which is antisocial personality. Now selective mutism. Here, selective mutism, there are some children. Those children are become mute, silent in specific situation, but not in the other. So where the children will speak freely in some setting, usually at home, but when going to school become silent. I think everyone met such children. The children that are freely talk in the home, but when they are going to relative or to the school, they become silent. This is selective mutism. And the question is selective mutism normal or abnormal? That's the question. Is it normal behavioral or abnormal behavioral? It is normal behavioral. It is normal behavioral in children. No need to intervene for anything in that children. I will repeat this again. The child psychiatry. Childhood psychiatric disorder, the ADHD. Here we have a child 5 to 7 years old with poor academic performance. A lady presented to you with hyperactive child. What to do? Call the teacher, ask for school performance. the same, please confirm that you can hear my voice clear now. Can you hear my voice clear now, please? Okay. Now I will repeat the childhood psychiatric disorder totally. For ADHD, we have a child 5 to 7 years with poor attention or poor academic performance. The differential diagnosis is deafness. So if you have that scenario of ADHD, which is a hyperactive child with a speech delay, what you will do, check the hearing of that child. Regarding management, the lady presented to you with a child with hyperactivity. What you will do, hyperactivity, so try to check the attention deficit by calling the teacher and ask for school performance. Poor school performance means that this child have attention deficit with hyperactivity, which is the mom come to you before for checking that. So this child having ADHD. What is the treatment for ADHD? Specific treatment is methylphenidate, which is psychostimulant from amphetamines group, and it may lead to drug addict. How you know that this child respond to this methylphenidate? By checking the symptoms if reduced or not. Autism, it's diagnosed by the mother. She will come to you telling you that there is no eye contact of this child, blah, blah, blah. All of you know the presentation of autism. So, I want you to know that there's 75% of autism child with mentally retardation. Asperger, it's the same like autism, but there is no marked language problem and there is no cognitive delays. Rett disorder, not important. Tics are important. This is the child who have repeated something multiple times. Child repeats something multiple times. The something is either motor or vocal, like coprolalia, grunting, blinking, blah, 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 any other movement. What is the treatment of tics? This child need antipsychotic drug. The obsessional deviant disorder, this is the angry child who defends himself against anyone, who can fight the older people. He is not afraid of anyone, and he will blame others for their own mistakes. Conduct disorder is the criminal child with a history of child abuse or drug, alcohol abuse in the family or family problem. On long term, he will become a criminal adult, which is antisocial personality. Selective mutism is a normal behavioral in children. If you have any question, you can ask now. Thank you for being with me in this class. I will finish for today to see you in about 2 days for the second class. For any question, any more information you need, just text me on Facebook or on Zoom. I will respond to you immediately as soon as I am available online. See you in the next class, inshallah. I hope you get benefit from this class. Now, how you will, that's a good question, Dr. Rita. What you will do, I advise you to reading of what we have learned today. Do not jump to read the undiscussed topic. Only read the discussed topic, because as you see, the file alone or the reading alone by yourself will not get any benefit. You need guidance. You need to know exact thing. Now, I am not, I want you to understand more than to memorize, because anytime in the exam or even in the real life later on when you are practicing, you will never forget those information. So understanding is better than just memorize. Later on you will memorize a lot of tricks, a lot of information. So for now, just reread what we have discussed today. Thank you again for being with me in this session. See you next, inshallah. Bye bye, everyone.